All right, welcome everybody to Seamless Transitions from Skilled Facility to Home Care. This is going to be presented by Comfort Keepers. We have Vivian and Sally with us. But before we jump into the presentation, I just wanted to let everybody know that we are going to have a webinar as well with University of California, Santa Barbara, and it's going to be going over gene cell therapy techniques, which involve Alzheimer's and dementia research and potential therapies moving forward, but it also incorporates other chronic illnesses such as diabetes and other things kind of in the similar vein. So if you are interested in joining that, we can send you a link to register or send you the flyer to register as well. Just let us know at the end of the presentation if that is something that you're interested in. But I will let Vivian and Sally take it away.
Good afternoon, everyone, and thank you for joining us today. My name is Sally Smith, and I'm one of the owners of Comfort Keepers serving the Burbank and Monrovia areas. I'm here today to support our client care coordinator, Vivian de Blasio, as she leads today's presentation, transitioning from skilled nursing facility to in-home care. But before we begin, we'd like to extend our heartfelt thanks to Lisa's Care Connection and their incredible team. Their commitment to empowering and supporting our family caregivers through education, wellness, and a strong sense of community is truly inspiring, and we're honored to be part of their mission today. As we go through the presentation, please feel free to submit any questions in the chat. We'll be sure to address them at the end of the presentation. Thank you once again for being here with us today. Let's get started. Vivian, over to you.
Yes. Thank you, Sally. Welcome, everybody. I wanted to welcome you to our table. Come together on our virtual table here to sit around as a community. It's important that we support each other and we work through the challenges that life puts in front of us. And today we're here to talk about that transition from a skilled facility to home and the options that you have. So before I get started, I did want to talk a little bit about some of the things that I like to think about and questions to put in the forefront of your mind about the issue of transition, because transitions are different for all of us, how we cope with them, the strategies that we use. Some people make transitions very easily and they're very simple. For some, they're difficult, they pose challenges. So how do we face those transitions? So as we go through these slides and we think about how we as a community, as individuals, and as families, right, build that resilience. So a lot of this is about building up those building blocks, our mindset, our resilience. At Comfort Keepers, we talk a lot about the human spirit, our purpose, the joy in our lives. How are we coming together to have these life experiences and offer help to each other as we move forward? So a little bit about us, right? Comfort Keepers is all about supporting individuals. We've been around for about 25 years. As you see, the stuff we have on board here, I'm not going to read it verbatim, but we've been around for such a long time. And again, as I stated earlier, we're about elevating the human spirit. We are a network of entrepreneurs and also serve over 600 locations across the United States and Canada. And we serve thousands of clients since 1998. A little bit about our approach. So we really feel it's important for people to be offered daily care that brings them a sense of joy, connectiveness, and purpose, right? We talk about individualized plans based on the whole person assessment. Whole person assessments, those are a crucial part of what makes us who we are. We really look at you as an individual, as a family. And when we're talking about these types of transitions, it's important to look at the physical health, right? The mental and emotional health, your social connections, your spiritual and cultural identity, your cognitive functioning, right? Economic and financial stability. All these impact us, our housing and our environment. So we use all these as factors as we sit with you and get to know who you are and how we provide these services. So it's a holistic understanding, right? It improves service planning. It empowers you as an individual to really explain who you are and where you are in that spectrum in terms of what your needs. Every individual is going to come to the table with a different understanding and a different desired outcome. The outcome is hopefully a transition into your home that doesn't require you to return back, right, to the hospital, have any difficulties in this transition. So why transition matters. So the importance of this transition is being at home provides a comfortable, familiar environment, reducing any stress and confusion, allowing clients to continue recouping in the comfort of their home. We all know that being at home makes a huge difference for us. So that transition from being in a facility to home really lifts your spirit. It provides you that joy. For me, one of the biggest things is, and please think about what brings you that joy. My dog is a huge part of that joy. So I know when I'm in a situation, whether it's the stressors of my day or, like I said, recouping from being away from at a rehab facility, and I have an animal that's been a part of my life. That animal being able to sit with me and being in my presence adds so much joy to my life. So family involvement is a huge piece, right? It lowers the exposure to any illnesses as we make this transition. So it really helps with reducing any rehospitalizations, any decline in morale or functioning, any medical noncompliance. We know there are people that really struggle with the idea of, why is it that I need to take these meds? Not understanding pain management and how to really work together. So we really work with the individual and the families to make sure that together we're a network that's supporting somebody in that transition. Success is a key that we're looking for in these moments. So a little bit more about our customized care plans. So companionship is huge. When you're recouping and you're in a situation where you're coming out of a hospital, these difficulties, they really wear on you. You're exhausted. So it's important to have that companionship to lift your spirits. We come in, we do the light housekeeping, we do laundry, we do meal prep. Every person is going to need something different. And so having those conversations in that initial meeting and setting up the environment to be successful is key. We do personal care and also connect with technology. So technology gives us the opportunity to monitor home sensors, medication management, and family communication, and make sure that holistically we're working together to make sure that people's needs are being met. So the benefits of non-medical in-home care after discharge. We look at this graph and it starts us off from the onset on the red, right? The nursing home readmittance risk drops when you have in-home care by 4% at the beginning. At the beginning, everybody's morale starts about the same. I love the picture at the beginning because the gentleman is really excited and coming out like, I'm home, and care provider's excited. Some of that happens, and some of it is about really working to achieve that sense of, I'm home, I'm happy. So everybody starts off about the same. And then, right, having that in-home care, also in terms of hospitalization, there's a reduction in that hospitalization. Within a 30-day period, we see that there's a huge improvement in being able to maintain where you are and improving your physical levels and emotional levels. So from 79 to 85%. It's a huge difference. So the next slide is more of a graph. So as I was saying earlier, when you look at the graph to the left, they're almost even, right? You're at the nursing home, there's a risk of readmittance. It starts the same. But as we were talking about earlier, if you're not taking your medication correctly, right? If you're not paying attention to what you're eating, it's too hard to get up and make your meals, making sure that you're nourished, right? As the time goes on, you start looking at the difference in terms of the increase in hospitalization rates. So it really shows that no follow-up care starts making a difference. Within that 30-day period, you see that difference. And the green, the non-medical in-home care makes a huge difference in people's lives and makes the situation more successful so you can move forward, be comfortable in your home, and make sure that you're able to get back to the life that you want to get back to. If you have any questions regarding those, please put them in the chat and we'll go from there. So our transition care services are pretty standard in terms of the importance of quality management. We really look at coordinating with the team, right, with discharge planners and nurses, so we're aware of the specifics to each individual needs. If you're coming out from having a stroke, that's very different than if you're coming out from having a hip replacement, right? Those needs are specific. So we look and make sure that we do home safety evaluations before we do the discharge. We do personal care assistance with the bathing, the grooming, to make sure that you're maintaining your physical health, right? We do meal preps and the medication management and the companionship services for the emotional well-being. Those are good alerts for family as we're back to our busy schedules, and you have a caregiver that can alert you, you know what, your father or your sister or your mother is feeling a little lonely. Maybe if you came by, for a little bit, or give them a call. Or we can also advocate for that person to reach out to their community because they are in a better place where they can have those communications with other people. Some of that is also just sitting and finding what brings you that joy, listening to music, right? Not having that those alarms going off everywhere or strangers coming in and out. That sense of comfort that really makes sure that companionship and service is meeting that emotional well-being for each individual. This is how Comfort Keepers makes a difference, right? We are all about continuity of care with consistent caregivers. It's vital that we are focused on a client-centered plan. I talked about that a little bit earlier in regards to making sure that we're looking at the whole person, right? Your mindset. It's really different for each person. I've had situations where I'm with families who themselves have been struggling before the fall. I have an example of a gentleman that I worked with that was recouping after a fall and very independent, used to doing his own thing. And all of a sudden, all his kids are flooding to him, telling him what he needs to do, how to manage that, and how to work together with the family. These are a lot of the different types of services that I know that Lisa's Connection really helps families come together and helps you build that resilience, understanding those differences and making sure that that plan makes sense for that person and that people's needs are being met. This gentleman that I was speaking of is a really quiet soul. He's a gentleman that just likes to do his own thing, likes his space. So he really needed a caregiver that was a quiet person who wasn't going to ask too much, but would know when to intervene, when to follow through with the care plan that we set up front, but in a way that was not intrusive, not too many questions, not much to say. A lot of it is presenting the environment, providing him some music that relaxes him, following the schedule based on the routine that he enjoys, and then really moving our services based on his needs. So we We have caregivers that are trained in post-surgical and chronic condition support, and that's vital. So we are flexible and we provide 24/7 care to people in need. We've had people that come right out of a situation and the family is overwhelmed with the level of care needs. So we do awake overnights. We're there with the individual. Some of this also happens, especially with someone who is awake, right? Sundowning has difficulties, especially with Alzheimer's and dementia, who might need more support at odd hours, and it overwhelms the family. So making sure that we have somebody who can be of support during those times is crucial to the success. That people aren't falling, that people are getting the support they need to be able to maintain their well-being and not re-injuring themselves in that moment. The benefits to patients and families, right? That peace of mind that I was talking about. Loved ones are safe and they're monitored. You can sleep through the night, get yourself up, do what you need to do, and know that someone's there making sure. We're reducing that risk of rehospitalization. We're improving recovery outcomes in a familiar space. And that familiar space, it changes everything. One of the things I like to talk about, even for myself, when you're going through something difficult, I have a little corner in my yard that I love to sit down and have that cup of coffee. That you breathe that in, that fresh air, that fresh cup of coffee. Wow, the joy that I get from doing that is tremendous. And it really re-energizes me. It gives me that peace and it helps me emotionally, right? And that companionship with both family and friends in those environments as we come in to make sure that those routines are part of the recovery. Here's some case examples. Let's say, Mr. J is transitioning from home after a stroke. With our help, he's regained his independence. He is facing the changes of what he can do in his environment with someone's support. It's also done in a way that we're accommodating his learning difference and also his communication. How are we making sure that we're good listeners? How are we ensured that his needs are being met, that Mr. J understands and feels like he's getting that support? And in those frustrating moments, are we providing those spaces for him to be able to get frustrated and know it's okay, that we're there to pick up that piece and allow him the opportunity to move forward? Again, each person is really different. Some people really enjoy that extra push, and some people say, no, 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 I'm going to tell you what I need and how this is going to work. So this again avoids that extra ER visit. So that's a huge piece, and it reconnects people with their family routine, right? People have routines. Bob comes to see you every Friday. Sally comes in and she has dinner with you on the weekends and she brings you lunch. Those make a big difference to people. So we have collaboration with the skilled facilities. We work closely with the case managers, social workers, therapists, and that really ensures a smooth transition and transparent communication with facilities. So that transparency is so important. We really need to be transparent about people's needs, their personalities, right? That whole person assessment, making sure that that information is documented in that care plan and that we're following up. We make sure that we communicate with facilities and revisit and make sure that we understand their needs and that those success rates for them continue, right? They are able to then say, hey, this is our success rate in terms of really rehabilitating people back into their homes. So we partner together to make sure those statistics stay positive. So finally, in terms of next steps, this is a little bit about who we are, right? You're welcome to contact Comfort Keepers when you're ready to get started. If you're interested in making this type of transition, if this is a part of something that's happening for you, i.e., any kind of surgery or even a mishap that happens. Many of us experience falls, and please consider us as an option. We do free consults with people. Enclosed is our number here, our Burbank number, and also our Monrovia number. So our website is also on here, www.comfortkeepers.com. You can get more information about who we are. Our address is located here again in the Burbank area and also the Monrovia area. Thank you again to Lisa's Care Connection, and for the opportunity to help our community with transitions from a skilled facility to in-home care. We really appreciate the opportunity to tell you a little bit about our service, and I'm hoping that this sparks some questions in your mind about what this might look like for you and your family. And I look forward to hearing any of those questions. Thank you.
Okay, so we do have a couple questions from the chat. Uh, how do you manage agitation and sundowning? It's the first one.
Okay. You know what? I think a lot of that has to do with, again, going back to that person-centered approach. Each person is different. How those experiences come out, and how they need to be managed. With some individuals, a lot of that has to do with that companionship. Some of it is also needing that help. Oh, please, I'm really worried. I'm very concerned. Some of it is more agitation, right? The agitation and giving people space. So being able to not take things personally and understanding that people are in need of support, listening, stepping back, and then re-entering is also a really good way to deal with that. Patience, 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 and really taking some deep breaths and remembering that what's said isn't a personal issue. It really is about supporting somebody where they are and where their needs are. So taking that on is a huge piece, and really just being able to flex with what makes sense for that person, and making sure that that service is delivered in a very personal way.
Thank you. Okay, we have a couple more questions. Um, somebody asked, is this care covered by insurance, Medi-Cal, VA for non-medical coverage?
Okay. So we are a private pay organization. So we also take a long-term health insurance coverage as well. So we do partner with the VA, and we are actually in a really good spot in terms of trying to make connections with additional resources that we're hoping to roll out really soon in terms of finding options for people who are facing any type of fiscal issues in terms of how to really get that support coverage. It's really difficult in these moments to really have that support, and how to find those partnerships are difficult. And we see that in the people that we're doing our consults with. And so we try to really brainstorm and provide options. We look at resource, we refer to like the Lisa connection and try to figure out ways for you to manage your stress. We also really we have network connections with other agencies that also support people that that provide a lower cost option as well. And as I said, we're rolling out something soon that might be of assistance to people in terms of just some respite assistance. It's respite help for people that have Medicare, and gives you a break in terms of just having some peace of mind to get away and gather yourself. One of the hardest pieces of what people do every day when they're caring for their loved ones is enduring so much stress and anxiety. And it's hard to just get that perspective. And having the opportunity to get away and have some respite makes a huge difference in your resilience.
Thank you. I think speaking about the resilience piece is crucial, especially when it comes to respite care.
Right.
Okay, next question is, what are some of the most common challenges you see as people do transition back into the home from SNF?
I think it's an acceptance of the changes that life brings us. It's a tough one. I think we all have it at different stages in our life. We do. But if you've been an independent person that has always been self reliant and have achieved a lot in your life, to accept the care of the people who love you is really different from for each person. And some of that is just letting go of that control. So that's a really good example of one of the toughest support needs, acceptance of what's in front of you and what you need. It's a negotiation. And some of it is not about picking a fight and saying that, oh, we are the experts, we know what's best, and this is how you need to conduct yourself. It really isn't about that. It's about meeting you where you are and really making sure that that quality of life standard, right, that your well-being is honored, and that when we flex, I've really seen people flex. It's right, that resilience and that flexing back and forth that really makes a difference in people's lives.
And if I can add to that, one of the things that we do see frequently is, by the way, Vivian, well said. There's a lot of reassuring because there is a fight back on, the care that we provide. But one of the things that we do uh, is reassuring them that we're going to be assisting them temporarily with only the things that they need help with,
Exactly.
and they will be able to lead the direction unless they're not able to be able to care for them, and then we'll jump in and help as needed. I think that has made a big difference when we go out and do consultations, especially at the skill facility, because it is important that we do meet with the care team at the skill facility. We discuss what is currently being done, what has been done, what is the progress, what can comfort keepers help with once the patient transitions to in home. And so as long as there's an exercise sheet to follow, and we will continue not only to do the meal prep, the toilet care assistance, but also assistance with the exercises that are needed to continue to help the client recuperate. Once again, as long as there is something given to us, our caregivers are skilled, and we only send caregivers that are appropriate for that particular client. And it really has made a difference in allowing our clients to accept the help, because we try not to hover, knowing that they were independent before the transition from home to skill facility, or I should say from home to hospital to skill facility. And now they're coming back home. So we have to respect their home, respect their rules, and kind of meet them where they need the help. And that has really, really made a big difference.
I think just to add to that as well, it's also that partnership with family, really understanding where family are coming from. And we all have family dynamics that come out in stressful moments, and partnering with families and making sure that we're helping them access resources to deal with that. If you were having family difficulties before a fall with your parent or something that happened, wow, some of that stuff just trickles in like you wouldn't believe. So that's also one of the situations that happen. And it really is about respecting people's boundaries, providing those resources, and really remembering that we're consulting, that we're working with them, and that we express what we think might work. And then we also flex and accommodate families with what is needed according to who they are and how they function.
Okay, another great answer. Thank you guys for sharing. And then last question is, how early should I start planning for this before my loved one is discharged?
Hmm. It varies with each person. Know that we have people who've had emergency situations, right? And so they're planning at the very end. I've had people that plan 2 weeks. I've had people that plan a month in advance. It really depends on the significance of the recovery, right? And their care needs. Some people need that 24-hour care to make this transition because physically that's where they were before the fall. And there are people who are going to make a quick transition, as Sally was saying, that it's an easy transition, and that we're only providing a minimal amount of service. Please know, and it's something that I think is important to emphasize, that meeting you where you are is about that. You can start with someone that's maybe receiving 24-hour care, and we really revisit these plans and adjust accordingly, because it is about getting us in and out. So, and helping people have that lifestyle to the best of their ability that they had before.
And if I may add to that, it is important for family that whoever, if family caregivers or just any family in general, that when their loved one goes into a skilled facility, that they stay in communication with the care team there. The care team will then provide information about how long the person will be staying at the facility. And what we could do then is, this is why it's so crucial to have that date, because you can contact our office as early as 2 weeks prior, as early as a week prior if necessary. As soon as you have a date of when the discharge is going to happen, we will comfort keepers will take advantage of that and then just go in and do the assessment in the facility, meet with the team, see what will need to be done, what is needed from us, so that we can help the client transition from skilled to in-home, and the transition is as smooth as possible.
Okay, great. And then I think just a question that I have that maybe other people would have is, if, let's say, somebody is discharged too soon from a sniff and is believed that they can go back to in-home care, but the transition period is rough and maybe they need to go back to a sniff facility. Um, has that happened before, and how do you guys handle those situations?
I think that I have not seen that happen at this point with us, but those are real life things that do happen. And some of that is also, again, back with the ideas that Sally was talking about, that partnership with the facility and understanding the condition that they left in. If we're given that opportunity to have that wellness assessment, to really come together as a team, that minimizes that risk. So if there's ever an emergency, we are expected to manage that, and we do. We have a system and a process in place to make sure that if there's any complications, that those issues are addressed medically. So we're here to support people, but we really work hard to minimize that risk.
Okay, awesome. Thank you. That was just a question that, I didn't think
Yes,
maybe people would have thought of, but it was something that I definitely had thought of.
yes. And it's
That's a
Um,
very
happening.
good question.
It
yeah,
is a very good thing. Thank you.
of course. Um, there are no other questions at this time. Is there anything else that you ladies would like to say before we hop off today?
I'm good. I think, again, just a thank you to everybody for the opportunity to talk a little bit about this transition and this important service in terms of families and how we come together. I think that we feel very privileged and honored to be able to serve our community. And it's vital that we remember that we're serving people who are vulnerable. And in that vulnerability, we need to make sure that we as a unit, right, that we stay connected, that we're using resources, and that we're letting people know when things aren't going well. So you don't have to be out there on your own doing this. You can easily feel overwhelmed and unable to manage things. And please reach out, connect with people, connect with resources. And together we make a better community as a whole. So thank you again.
Of course.
And I believe there's another question.
Thank you for pointing that out. How can
Not a-
families help with this transition if they are long distance and aren't in the same family as their loved one?
Okay. So, you know what? It happens. It really does. It's a big piece. I've seen people that are not necessarily connected locally, but are connected outside of that, right? They make sure that they're checking in on their family. Part of what we ensure is that technical piece, right? We talked about technology. We have a family portal where you can check in and see what's being done, what's happening. You see the care notes. We make sure that those connections are made. We have a family that I can tell you about that we have four siblings, and each or only one of them lived locally, and they were all very connected, and they made sure that they were coming together and had the information. We send emails to everybody, make sure that everybody knows what's happening, and then we really work to make sure that we understand who is making those decisions, right? That we're partnering with that person and that we're following however that family functions. So there's a lot of ways to make that happen. And I think it's important because
Mhm.
there's so many families that face that. And it's important for you to feel secure and in what services you're asking from us.
And just to add to that, I can think specifically of a client of ours that was has been a client of us for with has been with Comfort Keepers for many years. The son lives out of state. Mom very independent. She's definitely progressed in her condition. But when he initially reached out to us, he basically said, "My mom wants to make every decision about her care. I'm very limited to what I can do. How can you help me?" And so what we did is we did the consultation. She had actually fallen. He was calling worried sick because he couldn't make it out here. She was at the facility. We went, we did an assessment, we met with the care team. We kept them informed. We provided every detail of information that we had to. We made sure that he was in touch with the doctors via phone call, and the transition. By the time the transition happened, we had all of the instructions from the physical therapist, the doctor, all of the care team transitioned her into the home. And for him, it definitely alleviated so much stress because once again he was very limited because mom wanted to continue to be independent, but we were there to support with 24 hours at least for a couple of weeks. She bounced back, she still needed care, and he knew that if she ever fell again, we created a protocol where if she fell or something happened, she would contact him, he would contact us, and then we would send the right caregiver to go out and take care of her. We do have the ability, with that said, to go in and send our caregivers to help out at the skill facility if the family or if the client does request that. So that is why it's so vital to work very closely with the care team at the skill facility, because they need to know that we're going to be going out there. We're going to assist the client with whatever their needs are, whether it's toilet care or helping with feeding or walk, continuing with her physical therapy exercises by helping her walk around the skill facility. This is very, very vital. And some family does make those requests. And so all it takes is just that one call, and for communication to be, for us to be very transparent, and see, how we can help our clients, or anyone, even if the person happens to call and doesn't belong to our area, because all Comfort Keepers cover certain locations. We don't just leave the prospect there. We talk to them, get the information, and then we see what we can do to help them, and have them come in contact with the right, office, and make sure that they follow through with this process. I just wanted to throw that in, if we, whenever we get those calls. But one of the things that I do want to say is, you don't have to be a client of ours. If you have any questions, please don't hesitate to give us a call. We are very community oriented. We do a lot of helping. We've gotten so many calls from people that seem to be lost, don't know what the next step is, are out of town, out of state.
Mhm.
Some of them can be on vacation while their family member falls, and they have no one to turn to. Give us a call. We will help you and guide you through the process. The great thing about this is that there are so many connections that we have made with other resources, that if we're not able to help you, we will try to find someone that will, and we will make sure that, that person is being helped. So please don't hesitate to reach out. We're here to help you in whatever you need.
Mhm.
Great. Thank you guys again for sharing. And that is part of the reason why we love working with Comfort Keepers so much, is because of how community oriented they are. I can't say enough about how incredible they are. But just to kind of close out the presentation, Vivian and Sally's information, I will go back to the slide if anybody needs to write this down and take it down as a note. And then as a reminder for people, or as an announcement, I guess, for people that joined later in the presentation, we are hosting a presentation with University of California, Santa Barbara, about gene and cell therapies and techniques. That kind of goes into Alzheimer's and dementia care and potential therapies moving forward, but then also about other chronic conditions like diabetes and things like that. So if you are interested, I will be dropping the link to register below here in just a moment. And then if there's, again, any other announcements that you guys would like to make, feel free to do so.
Just one last announcement. If any of you are out of state and are interested in learning more about the transition from skilled facility to home, you can always go into www.comfortkeepers.com. And once you enter your zip code, you will be able, if you are out of state or out of our area, you will be able to find the location, the Comfort Keepers location that you belong to. And we all follow the same. Our motto is elevating the human spirit, and we're all very community oriented. So please don't hesitate. Go onto the website, look up the location that you belong to if you're out of state, and they'll be, or just out of our area, and someone will reach out to you right away.
Okay, well, thank you guys, and thank you for everybody who has attended and joined. This will be published on YouTube if you guys missed any of the first few minutes or first half of the meeting. It'll be posted on our YouTube in the next day to 2 days, so you guys can access that. Thank you, Sally and Vivian, again, so much for joining and going over this vital information, and we look forward to having you back.
Thank you.
Thank you. Thank you, everybody.
All right. Thank you, everybody. Have a
Be
great
well.
day.
Bye-bye.
Bye.
Bye.